We're now honored to be joined by Dr. Nicole McGrath-Barnes, founder and CEO of the KinderSmile Foundation. Good to have you with us, Doctor.
Oh, good to be here. Once again, I think this is my third time on the Steve Adubato show, so I'm honored. Thank you.
That's what happens when you're popular. Not me, you. Hey, tell everyone what the foundation is.
Sure. KinderSmile Foundation is a 501c3 nonprofit dental organization whose mission is to increase oral care access and oral care education for uninsured and underserved children ages 0 to 18, and we extend that to age 21 for our special needs population, and also perinatal mothers up to 3 years postpartum. But most recently, we've just expanded to Trenton. We have a dental home in Trenton. Yeah. We've seen adults. So,
yeah, talk about that Trenton expansion. I know the folks down at Jersey Manufacturers care deeply about that. One of the organizations, corporations, is big in supporting the. That's our state capital. Let's not forget that, Trenton. What Absolutely. Is going on in Trenton, and why is the expansion of your organization there so critical?
Okay. So as we all know, the state capital, and there's such a dire need here in the city of Trenton for access to oral care. We have 95% of the population, Black and Latino, Black and Brown community, and they have been plagued over the decades with a lack of access to quality, affordable oral care services. So we have been blessed by the supporter from the Estelle, Debbie Sands Gartenberg, her foundation, to expand and to increase access to care here for the indigent population.
Doctor, you know, I'm not sure people understand the connection. You and I have had many conversations about this, and I want you to expand on it. The connection between oral health and our overall health. And I'll complicate that in a moment with the COVID discussion, so go ahead.
So oral health is truly the gateway to total health. If you think about it, everything starts with the oral cavity. And for many decades, even centuries, the oral cavity has been displaced. It seems like the population believes that it's another organ, separated from the body. But that's where everything starts. Systemic diseases, if your oral cavity is not in good shape, let's say, or if the oral diseases are not under control, it affects your entire body. Children getting teeth prematurely extracted due to baby bottle syndrome or lack of access to care. What does that affect? Their speech. And teeth that are extracted prematurely, they are labeled now speech impediment. And the Black and Brown community are plagued with all of these labels. But if you understand that there's that direct correlation and connection, you can better take care of mouth and visit the dentist regularly.
You know, and by the way, there's a whole range. Check out our other interviews with Dr. Nicole McGrath-Barnes. We've done several, as she said before. We've talked in greater detail about some of these things as well. But, you know, there's a graphic that's going to be up on the screen in just a moment. It's simply called Confronting Racism. It's an ongoing series we've been committed to try to confront racism in all its forms. Do you believe, Doctor, that part of the reason for the Black and Brown community suffering the way it has and not getting access to oral care that is needed, that affects our overall care, is in some ways connected to racism?
Absolutely. And unfortunately, Steve.
What's it based on? Like our kids, and when I say our kids, our children, we were blessed and fortunate to get them the oral care that they needed all the way through, all the checkpoints, whether they do what they're supposed to do or not right now with flossing, it has nothing to do with other than laziness. That being said, that's not always the case for others in certain communities, disproportionately Black and Brown. In Trenton, 34% of the families and children living below the poverty level. That's not Oh, yeah, of course you're going to do that. That, in some ways, is the exception, not the norm, correct?
100%. 100%.
Why should we all care about that? Because I know we should.
Because they're human beings. They need to be edified and dignified and poured into, just like you, those who are fortunate. And unfortunately, we don't have the funding that's poured into a lot of the community organizations to uplift and to educate the population. It really starts with the education and the compassion to care. We need more funding in our inner city. We need more funding just for programs, continuous funding. We need partners. We need large partners to come in and realize that this is systemic racism and it's unfair.
Let me try this. COVID has complicated things. We're taping this at the end of 2020. It will be seen in 2021. To what degree has COVID-19 adversely impacted oral health care, particularly in urban communities that you're serving?
Oh, gravely and drastically. When you talk about the indigent communities' lack of access to care, many of them visit the hospitals because they don't have the facilities or the access to care to go to that's affordable. They visit the hospitals and they believe that the hospitals that's their dental home. They go for palliative treatment and a swelling and an infection. The swelling, the infection goes down. They think they're good. They go back. COVID has completely revealed to everyone nationwide that there's huge problems in our indigent population. And I know with KinderSmile Foundation, our 3 dental homes, we were closed for 3 months. But we had over 36 emergency teledentistry cases that we had to address. I was on pins and needles because not too many people realize that this oral disease, this infection can spread to the brain and people can die. Just like Diamante Driver in 2007.
Remind people real quick, Doctor. I don't want people to forget. Go ahead, I'm sorry.
Yes. This is the reality of what's happening in our community.
What happened to Diamante? Please remind folks.
Diamante Driver, a 12-year-old Black boy who resided in Prince George's County, Maryland, a predominantly county in Maryland. He had Medicaid and he was unable to see someone to prescribe medication for him for a tooth infection. Medicaid lapsed. Mother didn't have the funds to pay for a prescription, a simple prescription, Steve, antibiotics. He would have been alive today, but to no avail. And the mom ended up burying her 12-year-old boy due to a brain infection caused by a dental abscess. What I see every single day in this indigent community. November 9th, we had our grand opening.
2 seconds, go ahead.
Oh, November 9th, we had our grand opening. We get a call from Capitol Health Regional Medical Center. An emergency room physician called and said, "Doctor, we have an 11-year-old boy here with an abscess, swelling the size of an orange." I said, "Bring him in." Right after the grand opening, he was the first patient we saw. Literally, Steve, the size of an orange. Nowhere to go, never been to the dentist, here in Trenton, 11 years old. He could have been a Diamante Driver. This is what the Black and Brown community is experiencing on a daily basis. It's a reality. This is what they're living with. And it's unfair and it's unfortunate. And that's why we are here in Trenton and other indigent areas to increase access to care for all.
If that doesn't move you, nothing will, folks. We're honored to be joined once again by Dr. Nicole McGrath-Barnes, founder and CEO of KinderSmile Foundation. Doctor, I want to thank you so much. Keep doing what you're doing.
Thank you so much, Steve. Thank you so much. Really appreciate this opportunity.
You got it. We'll be right back.